Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Today we'll be talking about the Elderly Health Program within the Ministry of Health, and joining me on the program today is Dr. Melissa DeHart, the coordinator for the Elderly Health Program. So we're focusing on elderly health, and I want us to start off by talking a little bit about the Ministry of Health Elderly Health Program. Could you tell us about that for our listening and viewing audience?
Yes, so the elderly health program we have at the Ministry of Health is part and parcel of our primary health care program, which endeavors to guarantee a package of essential health services to all individuals. Specifically, speaking of the elderly, the program focuses on public sensitization, first and foremost, to ensure that persons are educated on the issues that may face older adults within our communities, the changes that they experience, and how to better manage them. In an endeavor to do this, we work along with faith-based and non-governmental organizations where we do community work, whether it be activities for exercise, home visitation, to ensure health and wellness, of course. We also work closely with our health staff, healthcare workers, to build their capacity through training, and this is ongoing throughout the year to ensure that they're equipped to provide services to our elderly persons within the primary healthcare settings, the clinics and the hospitals, and to visit those that are shut in, bedridden, etc., and provide care there as well.
Wonderful. What strategies has the Ministry of Health implemented to better support the elderly population across the regions of Guyana?
Well, our strategies do include extending the aforementioned training and education of our health staff, especially in the primary healthcare setting, because those persons will be the first to interact with our elderly persons. And research has shown that in our chronic disease clinics, when we go to the primary healthcare facilities, or what we call health centers, the majority of those persons are elderly persons. Inclusive of that, we are currently working on an extensive communication strategy where we will be working in-house with our own health promotion team and involving our stakeholders such as radio, television, newspapers, etc., to better educate the public, specifically caregivers. Caregivers are those persons that actually have the daily task of interacting with older persons. We have also developed and are working in tandem with the Ministry of Social Protection and their safety net programs to ensure that we monitor and support long-term care facilities, or what we call old people homes in Guyana. We do have a few, the majority in Georgetown. So we are working diligently to ensure that is accomplished. We are also continually working to not only educate and build the capacity of primary healthcare staff, but we are hoping in some endeavor in the future to have scholarships and what we would call certificate programs and postgraduate programs to better equip our doctors, social workers, and all levels of staff. In whatever capacity they encounter elderly person, they will have the knowledge to provide mental, social, and physical care for that person.
Great. Thank you so much, Dr. DeHart. A lot of work you guys are doing there, and I'm so happy to hear about it. If I'm correct, I believe it was last year, in 2022, you guys started rolling out some elderly health programs at the different health centers. How does that work? And for those caregivers who are at home and they're listening to the program or even watching the program, how can they get their family members involved in what you guys are doing across the regions in the different health centers and health facilities?
Right. So I'm glad you did mention that. As part of our community-based platform work, outside of training our healthcare workers in the community health centers, we are working along with non-governmental and religious organizations to have what we call elderly clinics within the different regions. So this may range from a specific day in some regions to specific hours of a specific day set aside just for the elderly. As we would have mentioned, it already exists that the chronic disease clinics that they have, the majority of persons are elderly persons. So what we're now having is a more integrated look and assessment tools being provided to our workers for them to zone in on mental issues such as Alzheimer's, forgetfulness, and all other degenerative issues that may happen mentally with our elderly. If they're having joint pain or mobility problems, we have established, or not established, I would like to say strengthened, because these systems have already been existing, working in tandem with physical rehab, to ensure that persons preserve their capacity of function, etc. So if anyone is interested, and they should be, because aging is an ongoing process,
Yes.
and we want to cover the preventative aspect of aging before someone becomes sick, and even when they're ill, to have care, they can visit any local health center and inquire about what is needed for their elderly person. Even if the person is not sick, they should have a checkup at least every year. And this is in its entirety: ear, for hearing, their eyes, their mobility, do screening to see if they have high blood pressure, high blood sugar, or any other needs. So all of these services are available at our local health centers in all the regions. And if any additional services are required, whether it be blood testing, physical rehabilitation, screening for eyes or ears, or even surgical intervention, they can be referred to a tertiary institution or a hospital where they can get these services.
Dr. Diart, I'm so happy that you mentioned prevention, because I know that this is one of the areas that the ministry has been doing a lot of work in. And with that, I wanted to ask you, how often should an elderly person visit their health center? You did mention that they shouldn't wait until something happens or they have an issue, but they should do routine checks. So what does that look like on a weekly basis or even a monthly basis?
All right, so we'll look at it from different aspects. Let's say you have an elderly relative, or you are elderly yourself, and you have never been diagnosed with any type of illness. So preventing something means that we're trying to stop it before it happens. So just to stay healthy, every year, I would recommend at least once a year, the person should do a full checkup, which includes their blood testing, which would give you your heart function, liver function, and make sure all your internal organs are functioning as they should. And you do have screening methods that are very fast at your local health center for your blood sugar, blood pressure. Even your hearing and eyesight can be assessed or referred to where that can be done. So on a yearly basis, just to have that assured. And even in these screening processes, when persons are now being diagnosed, or they get that, okay, now I know I have high blood pressure, high blood sugar. Unfortunately, many persons are diagnosed with chronic illnesses, high blood pressure, high blood sugar, and others at late stages, late 50s, late 60s. So it's always beneficial to keep checking. If the person has already been diagnosed with high blood pressure, high blood sugar, arthritis, hearing impairment, memory impairment, then they should be a member of their local clinic. All right? Many persons get diagnosed at a hospital and they're sent to follow up in their community. So whatever is the closest health center in your community, you should register there, and they will have you coming back monthly, or if all is well, every 3 months. All right? So I do not recommend staying home and, buying medication over the counter. Many persons do that. It is important to be a member of a health center because, number one, they will have all the drugs you need, the medication, so you may not have to expense yourself because medications are free through the government's health system. Additionally, once one is on medication, it is important to have your blood tested every 6 months to ensure that there are no side effects and that the body is in general health and in harmony with the medication you're taking. So the health center does support you with that as well. All right? And it is recommended that you have a doctor's advice through the health center before you change medication, stop taking medication, or even if you want to do something that you've read or researched, just have a doctor's advice at first.
Wonderful.
Hello, my name is Dr. Melissa Dihart. I am the coordinator for elderly health at the Ministry of Health. We are in the month of September, and September is Alzheimer's Awareness Month. And within this month, we are working with the theme, No Dementia, No Alzheimer's. And within this campaign, which will be international and worldwide, we're focusing on empowering caregivers with the knowledge about Alzheimer's. Having knowledge is power, so we should know what are the symptoms and what to look out for and where to seek help. There are some basic symptoms that you could identify in your loved ones, such as memory loss, not remembering the name of persons or objects, aggression or mood changes, sadness or depression. If you or anyone you know, elderly persons over the age of 60, are experiencing any of these, you can feel free to reach out to your closest healthcare provider or health center, which will guide you on what is needed for the health and well-being of your loved ones. Remember, knowledge is power. Let's take care.
So happy that you mentioned the importance of having the doctor's advice. I know many senior persons, they do believe in the traditional methods of treatment. And so it's important for you to have the doctor's advice. Could we talk a little bit about caring for the elderly? How can caregivers better care for elderly persons, their physical, their emotional, and even their mental needs? How can they do that effectively?
All right, so it is true that nobody ever teaches us how to take care of another person, be it a child or an elderly person. So it is important to avoid what we call caregiver burnout. There's where the caregiver, whether it be a sibling or a spouse, they get frustrated because they don't understand the process. So the first step is educating yourself, all right? Going online, doing research, even YouTube. There are many plethoras of resources out there to explain to you, for example, why older persons don't eat as much, why they don't drink water. As you age, you lose your sense of taste and you lose your sense of thirst. And there are many times you have conflict in the home because you think the older person is being deliberately stubborn or they don't want to do this or that. But as the body ages, there are differences in what we need and respond to. All right? So to avoid all the arguments over food, the food don't have taste, they don't want to drink water, etc. It is important for us to know, especially, for example, if somebody doesn't have teeth, right, or they don't have dentures, you need to make the food a little softer.
Yes.
All right, so they could digest it. Physical activity is important as well. I know a lot of times we love our older persons and we think not having them do anything is the best thing, but that is further from the truth. An older person needs to have activity so they could have good circulation and they could maintain their joints and avoid pain. So even to the simplest activity of walking around the yard, doing a little gardening, helping with food preparation, helping with watching the grandkids, reading the newspaper. You need physical and mental stimulation as well, all right? And that will help to upkeep the person.
Thank you, Dr. DeHart. Could you tell us about the importance of having conversations with the elderly?
Oh, it is very important, especially when we speak of memory. As we get older, memory loss or forgetfulness is natural. Some persons go to the extreme where they have something called cognitive impairment. There's where you'll have your Alzheimer's, your Parkinson's, etc. But even as you and I, two young ladies, we forget sometimes.
Yeah.
And as we get old, it's easy to forget. So to remedy that, to slow it down and to keep the older person sharp, so to speak, it is good to have conversations with them, engage them. It is good to have younger persons and even the children around engage them in conversation. And I do recommend that persons that would have been retired, have a skill or a specialty, you could still volunteer those services, whether it be in church or as part of, let's say, the Lions Club or any other non-governmental organization. It is good to keep interacting with older persons so they do not lose their memory, they stay sharp, and there's so much resources they can share with us. We could learn a lot.
Yeah.
So talking to them is good.
And then too, I think it will also help them to stay
Yes.
connected with current affairs and what is happening now.
Exactly, exactly.
On June 15th, 2023, we observed World Elderly Abuse Awareness Day. Could you tell us a little bit about abuse in elderly and what are some of the signs of this and what can even cause some of this?
All right. So, as you did mention, the 15th of June every year, elderly abuse awareness is brought up, and the main focus is to let the general populace know that this is an issue. Abuse and violence has no age limit. Specifically speaking to the elderly, what would make anyone want to abuse a loving grandparent or a fragile old person? There are many things. First and foremost, as we did mention before, nobody is taught how to take care of an older person. So a lot of times abuse comes from lack of knowledge and frustration with the changes and the different demands that the older person may have. Specifically, if the older person is dependent, let's say they're in a wheelchair, they're vulnerable, they're ill, they're bedridden. So that acts of the caregiver more physically, mentally, more time, more finances, etc. And that can frustrate an individual. If the individual has no help socially or through the family, for example, you have siblings, you take mommy one day, I take her the other day. Please help me cook some meals. I have my children, I have my husband. So you need somebody to help you with time and tasks so you're not overwhelmed. That can avoid feeling frustrated and unintentionally abusing someone. There are different types of abuse, mind you, all right? So abuse could be verbal, physical, financial, whereas we're taking away the person's money or their financial freedom. You have sexual abuse, all right? So there are different ways in which knowingly or unknowingly someone can be abused. And again, most of this is based in, outside of the occasions where you may have somebody that is abusive in general, normally in nature they're abusive. If you put a vulnerable person in their care, well, that's just a recipe for disaster. But many a times abuse stems from the lack of knowledge and frustration. All right. Some things that we can do to avoid is addressing those elements that I just mentioned before. Trying to educate yourself on the changes that the older person goes through and their needs. Once you understand and you will be able to identify, it will be less frustrating because you expect it. Having help and time out as a caregiving person, or what we call a caregiver, having that time to yourself, even if it's a couple hours. And we also advise caregivers not to overwhelm themselves with the thought that they have to do everything perfectly. All right? You're allowed to make mistakes, well-intentioned. Additionally, for example, not only in the home, but in what we call old people's homes or the long-term care facility, to avoid abuse there, we should regularly check in on our elderly persons if they're not close to us, phone calls, visitations, observe their surroundings, observe their physical for signs of abuse. Signs of abuse may include physical bruises or scarring to the person's physical presence, which is obvious. The person may have a change in mood or how they act. They may be depressed or withdrawn, they don't want to talk, etc. If the person looks malnourished, all right, or they're wasting away physically, that's another sign of abuse. They're not getting enough to eat, etc. And especially if your older person is staying in a facility, don't be afraid to communicate your concerns with the administration of that facility to get clarification as to what may be happening. In extreme cases, we do advise persons, if through discussion and clarification the situation cannot be resolved, to reach out to your closest police station to announce and report any forms of abuse. We also have, as a resource, the Ministry of Social Protection, Ministry of Human Services, as it is known, has a hotline for any forms of violence. I do believe the contact number is 914. And you can get on to them to announce any form of abuse. You could have social worker intervention and support for caregivers. am Dr. DeHart, the Coordinator of Elderly Health at the Ministry of Health. Let's talk about medications. As we all get older, unfortunately, some of us may suffer from chronic illnesses, such as high blood pressure, high blood sugar, and as a result, we may have to take medications. What are some important steps to ensure that you get the full benefits of your medications? Make sure that you have proper storage. So, we must set aside our medications daily. They are available pill boxes which have the days of the week, which will help to sort your medications and you wouldn't forget. Or you may keep your medications in the pre-sealed packages received from the health center, clearly labeled, which will guide you. Make sure to set a reminder. Set a phone alarm. Use the almanac. Have a relative remind you. Some way of remembering to take your medications on time. Make sure you know which medications go together. If you take medications that do not go together, it may be too strong and overwhelm the system, causing many side effects. Ensure you're clear from your doctor which of your medications must be taken together. Additionally, you must know when your medications are expired. All medications have expiry dates. Please check and ensure not to take expired medication, because if the medication is expired, you will not get the benefit of the medications. Know which medications require you to eat or drink before taking them. Most medications require you to take them on a full stomach, but this is not always the case. Please find out from your doctor if you should eat before or after taking your medications. This is very important. And lastly, look out for side effects. Many medications may have side effects that may be tolerable or intolerable. For example, in the elderly, you may have, when you take your medications, dizziness, abdominal pain, nausea. Look out for these side effects and immediately let your doctor, healthcare provider know so they may provide an alternative or a change in medication.
Thank you so much, Dr. DeHart, for joining me on the program today. But before we go, could you tell us a little bit about the future projections of your program?
All right, so we are diligently working not only to make sure that we have ongoing training for our healthcare workers, because you do know every day, every month, every year, we have new batches of healthcare workers coming out. So we want to establish a curriculum within those training programs, whether they be nurses, doctors, PCA, so everyone has that knowledge, and of course that would be ongoing. We will have a strengthened communication strategy where persons will be hearing and seeing more and having more knowledge out there of elderly issues and how to manage their elderly counterparts, family members. We are also looking to strengthen our relationships with our stakeholders, other ministries, non-governmental organizations. The Ministry of Social Protection, Ministry of Human Services is our strongest ally in this because they do deal with elderly persons. And of course, we are hoping at some point in time to have an expanded staff and unit to ensure we're able to have focal points and coverage in all regions where we have established community work and setup and some type of support and information group established in all regions to give caregiver support, elderly person support, and to strengthen the referral system we have for any health and social issues.
Thanks again, Dr. DeHart. I want to encourage you to keep up the good work that you have been doing within your department at the Ministry of Health.
All right, thank you for having me.
Thank you for joining me on the program today. I'm Alicia Martin saying goodbye for now.